Let me explain to you what peripheral neuropathy is. The body has two different divisions of the nervous system. There's the central nervous system, which is your brain and your spinal cord in your back. And then there's the peripheral nervous system, which are the nerves that go down your legs or go down your arms. So peripheral neuropathy is damage or disease that affects the nerves that go down your arms or go down your legs. And that's typically associated with things like numbness, tingling, balance problems, burning, cramping. You can't sleep at night because your feet bother you, or you have temperature differences because you may have cold feet or cold hands. So when you have 0% loss of function and everything's working fine, you typically have about 150,000 nerve fibers working for you going down your legs. When you're at 50% loss of function, you have lost about half of those fibers. So you have about 75,000 fibers per square inch. When you have 90% loss of function, that's when you start to develop ulcers and it can lead to amputations. So this cartoon is the nervous system, and this shows you the brain and the spinal cord, and then branching from the spinal cord are the large and small diameter nerves. The large nerves are the ones that control muscles and they control balance. And the small nerves are the ones that send pain signals up to the brain to alert you that there's a problem. So if I'm walking in my home and I step on a tiny sliver of glass and I don't realize that this glass is in my foot because my foot's completely numb, after a couple of weeks or months, I'm going to develop an infection. And after a while, if that infection is allowed to manifest, I'm going to lose my foot. It's going to have to be amputated. So it's very, very important that those large and small nerves are working for you. When you have peripheral neuropathy, the medical doctors will typically give you one of 4 medications. They'll give you gabapentin, Neurontin, Lyrica, or Cymbalta. Those medications were not originally formulated to treat peripheral neuropathy. Neurontin, gabapentin, and Lyrica were actually anti-seizure drugs. They're anti-epileptic drugs. And what they do is they slow down your brain so you don't feel your feet. So when it comes to things like numbness and tingling and balance problems and all these different symptoms on the kaleidoscope of peripheral neuropathy, it's actually not going to do anything to help you at all. And so as your condition continues to get worse and worse and worse, the doctors respond by increasing your dosage more and more and more until they say, I'm sorry, there's nothing less that I can do for you. You're just going to have to live with it. One of the problems with peripheral neuropathy is a problem called hypoxia, or decreased oxygen delivery to the different tissues. We know that oxygen is required by all cells for optimal health. So if you cut off the oxygen supply to anything, it can start to wither and die. The older that you get, the less blood flow that you typically have, and so that can lead to peripheral neuropathy. So the one slide at the very top shows the original tissue doesn't have a very good blood supply, and at the very bottom on the other side of the screen, it shows after 24 weeks after stem cell therapy was applied, we have angiogenesis, or the development of new capillary beds, and with that, fresh, oxygen-rich blood delivered to the tissues, and that is how you fix neuropathy. There's been research done on stem cell therapy for neuropathy, and researchers found that stem cells reversed degeneration and restored function to the nerves. And they concluded that stem cells are an excellent choice as a potential strategy for peripheral neuropathy.